Make the choice to begin anywhere in your life, and the journey has started. And along the way, be inspired. Listen to the stories by joining the president of Howard University, Dr. Wayne A.I. Frederick, on The Journey.
Howard University's healthcare workers are on the front line keeping our community safe. The University Hospital has been in the spotlight as we continue to use our resources to the best of our ability to serve our district residents. Our guest today is leading the medical staff, and she will discuss with us what has been happening at our hospital, as well as what we can expect in the near future. Hello, my name is Dr. Wayne Frederick, and my guest today on The Journey is Dr. Shelly McDonald-Pinkett. She's the Chief Medical Officer here at Howard University Hospital. Welcome, Dr. Pinkett. How are you?
Thank you. Thank you. Pleased to be here.
Good. So first, before we jump into everything and anything about the hospital, let's start where it started. You are from Amelia Island, Florida, which I've actually had the opportunity to visit. Tell us a little bit about what that was like prior to you moving to Baltimore.
Oh, excellent. Well, I was born in Amelia Island, Florida. That's where my family is from.
Okay.
It's the southernmost sea island off the east coast of the United States. And so we are part of the Gullah Geechee people.
Right.
And it's a small town of 300 or very early on. Now there are about 30,000 people, so the demographic is changing a bit.
Yep.
But it's a wonderful place to be, and I'm pleased to hear that you had the opportunity to visit.
Yeah, beautiful place, but you're right, it's very tourist friendly now. Tell us a little bit about the history of your people.
Oh, well, I'm certainly not the expert on that, but I can tell you growing up that one of the challenges was understanding exactly what it was that my grandmother and others were saying. And so there's definitely the language, a bit of the language differences there. And there's a holdover of the customs of the people of West Africa. So there's lots of rice, lots of shrimp. It's all about the food and the low country boil. So it's just a wonderful history.
Do you still visit Amelia Island from time to time?
I am in Amelia Island almost every month, if not twice a month.
Wow.
Absolutely. So my mother is there, and I have cousins and other family there as well.
Okay, excellent. And you are a product of the Baltimore public school system.
I am. I attended Western High School, one of the preeminent women's high schools, and the only one in Baltimore City. That's actually not true. There's one other, but we say it's the only one. But a great place to go to school and to be educated.
And tell us a little bit more about what it was like at the time that you attended the Baltimore public schools. Baltimore has been in the news for a myriad of reasons over the past few years, but one of the things that I have encountered is that the Baltimore public school system has really gone through a transformation. But at the time that you went there, there was really a lot to talk about in with respect to what happened in that school system and what did it expose you to?
Well, absolutely. So my early elementary education through high school was all in Baltimore public high school system. Both of my parents are educators in the public school system, and my youngest brother is now. But I'll tell you, as I was coming through that system, the teachers, the educators were very focused on making sure that the students learned. We had very specific tasks, and we were held accountable for making sure that those tasks were completed. I can remember one of my science teachers saying, you know, dare to be different. I remember that to this day as we worked on very specific items. And so there is often the thought that it's not cool to be educated and to study and to learn. And those teachers made sure that we did exactly that, that you focused on your education and knew that it was important.
So they helped you overcome that peer pressure. That's excellent. Now, you obviously grew up in a household with educators. What was that like? How much pressure, or for that matter, how much encouragement did your parents supply with respect to your overall field of study and how you approach your studies in general?
Oh, that's a great question. Thank you for asking that. The household where I grew up was very comfortable and very encouraging. I did not decide to go into medicine actually quite late. You'll often hear people say that, you know, in their early years they decided they wanted to pursue medicine, but I actually pursued music. So I attend the Peabody Preparatory School for music, piano, and that was my original intent until I learned that it's very difficult to have a career as a concert pianist. But my family is very encouraging. I have 2 brothers. My youngest brother is an educator. My oldest actually had worked and contributed to the Hubble telescope with NASA. So I was fortunate to be in a household that was very supportive and very encouraging of study.
So let's talk about the music a little bit. Do you still play the piano?
Oh my, I think that I do. Others around me don't think that I do at all. I know 4 songs, and those are the 4 songs that I knew when I graduated from the prep school. Yeah, so that's the extent of it. I would never play in public.
Understood. So then you decided to pursue your undergrad studies here at Howard University. Why Howard at that time, and how did you even come to know about Howard coming out of Baltimore?
Absolutely. So my parents actually attended another HBCU, the one in Baltimore, Morgan. Okay. But when I started discussing medicine and, you know, thinking about the sciences and chemistry, I think it was my mother who said, well, all of those who go into medicine and study sciences go to Howard, so that's where you'll go. And I mentioned a few other schools because recruiters had come to my high school, and there was another school that I was thinking about, and my dad said, well, you can go there if you want, but you have to figure out how to get back home. So Howard it was, and that's where I came.
That's excellent. Yes. Now, clearly something in high school happened to really convince you about a STEM discipline and to ignite your love about medicine. What was that?
Absolutely did. So there was actually someone that came to our school to talk about medicine as a career. And I remember very distinctly this person sharing information about the sciences and health education. And what I did at that time was volunteered at Johns Hopkins Hospital, just in the child care area, and I had the fortune to meet a cardiologist, Dr. Watkins, at that time, and we had a great conversation. He visited where I was taking care of these little kids in child care, and so it's really about mentorship, exposure, and just knowing what the potential is and what's available to you, and then being encouraged to do that. So yeah, that's what happened.
And then in your undergraduate experience here at Howard, what was that like at that time, coming from Baltimore, as much as you were in a STEM discipline, Howard is what it is to so many undergrad students. So what was your experience like?
Oh, I love Howard, you know that. So I won't start by telling you that I met my husband in organic chemistry, but what I learned is that there are just so many brilliant students, so many brilliant people here. Dr. Morris was one of my preceptors and a mentor to me, and as I decided to become a chemistry major. And just being around so many people who looked like me, who had same background, different backgrounds, international students, and just the great exchange. I stayed in Baldwin Hall, 2nd floor, right down the street there, so great fun. And I was telling someone here that I've actually been in this room because one of my classmates was a communications student and needed someone to act in a project and asked me to do that. But just can't say that I've had a better experience than being here at Howard. Yes.
And then that prepared you for what Howard does now better than any other institution in the country. We send more African Americans to medical school throughout the country than anyone else. And so you went on to go to medical school at the Medical College of Pennsylvania.
I did.
And what was that experience in contrast to your undergrad experience?
It was very different, very different. There were 4 students of color in my class. I was one of 4.
Out of how many students?
Oh my goodness, I think in my class there were at least 100 students.
Okay.
And so just a very, very different experience. But required a fortitude and the ability to speak up and to advocate for yourself. And but it was a pleasant experience, yes.
Good. And then that led you back here to Howard University Hospital, where you came back to do your training.
Yes.
At the time that you trained, there were giants here in medicine in particular. What was that influence like during your training in particular, to be around those luminaries?
Absolutely wonderful. I can tell you, I selected Howard specifically, despite interviews at all of the other areas, because of those people. I was interviewed by our chairman at the time, who asked me real questions, questions that challenge your thought processes, whereas I felt that that was not the case at some of the other interviews. And so that gave me the impression that the team here, those folks that you mentioned, were very interested in my education and seeing that I succeeded. And I'll tell you, Dr. Clive Callender invited me on his radio show. I think I had been at Howard just a few weeks, and I did not know everyone there, and I think we met in the hall, and he said, come on over, let's talk. And it was about heat stroke, so yeah, just a great time. My first encounter was with Adrian Hostin. I met Clive Callender, John Townsend, all of those luminaries were present at that time. And I did have the fortune of meeting Lester Henry, though it was toward the end of his career. But just watching him teach, the dedication that he had and the discipline that he had for educating students was just amazing.
I remain a big admirer of all of those people that you've mentioned. Dr. Henry was absolutely, just seeing him coming down the hallway to see one of your patients was so awe-inspiring, and as you said, very disciplined, very measured. Same thing with Dr. Hostin, who I've come to know very well, and his son ended up being one of my classmates as well, so certainly had a great experience there.
Yes.
After your residency, what was your decision process in terms of career-wise? What to pursue? Why stay in academic medicine versus private practice, or why not dabble around? What was your decision-making process like?
So it's all about the mentors. I will tell you that it was not my intent to stay in academic medicine. I intended to go into a practice, and Dr. Hostin called me in his office and said, we need to have a conversation, and what is it that you are thinking that you'd like to do? And he made a proposal to me, and this was about starting the general internal medicine program. He thought that this was something that was required, and it gave the opportunity for the subspecialists to focus more on the subspecialty, and for the internists to run the inpatient services. And so that's how I started, and that's how I stayed with that particular challenge.
That was visionary. If you think of what we do now in the hospital, the fact that we're talking about hospitalists and so on, he clearly had seen way down and around the corners.
He absolutely did. He laid it out and told me what his thought process was. I met with Dr. Callender and some of the others, and we had some, Dr. Mattori, we had some great conversations about it, and that's how it started.
That's fantastic. So you got here, you've seen Howard many different, from many different viewpoints, as well as you've had an extensive mission work with an organization called NOAA, and I'll let you, talk about NOAA and tell our audience a bit about that organization, and then I'd love to hear about the mission work that you've done with them in the past.
Oh, absolutely. So NOAA is the national organization for the advancement of Haitians. So who would think that a person from Baltimore would end up working with that organization? But sometimes it's about the opportunity that's in front of you. And during 2010, that was a tragic event that took place in Haiti. I happened to be president of the medical staff at that time, and there were faculty members who came and said, listen, we need to do something, we need to help. And connected me with that organization, and we started with Howard University Hospital donating its ambulance to Haiti. And we began an educational program where we had our medical students come with faculty members, and from all disciplines, pharmacy, dentistry, nursing, to set up a program in the northeast region of Haiti for study and for service. We included students from the Haitian universities and just had a fabulous time, an outstanding program, and move forward from there with your support, and we thank you for that as well.
Well, it has grown significantly, and by the time I got there, you guys were opening a clinic, to my absolute amazement, in Cap Haitian.
Absolutely.
And this is, as much as there's a major volunteer component, you really also emphasize the academic component. We now have standing electives there. Currently, obviously, the pandemic impacts that. But tell me a bit about moving from just the volunteer activity to that structured academic program, and what were the challenges there and how you've met those challenges.
Yeah, absolutely. So one of the importance, the mission is important, the service is important, but we are an academic institution and we wanted to make sure that there was an educational component to that. So we structured courses. Students studied Haitian culture. We talked about social determinants of health. We had each of the subspecialties give lectures on caring for patients in less resourced areas. So we made those lectures and didactics a part of that educational study. Then, of course, we provided the service under the supervision of faculty members. There were operating rooms going under the supervision of faculty members. And I say that because there are often instances where service is provided, but it may be a little different than the service that you might provide in United States or another country. And we wanted to assure that the service we provided was the same as what we would provide here in the United States. So a very structured program.
And that's excellent. I know the dental aspect of it has really grown as well. And when you think of the need, the other thing that's impressive is, as you mentioned, working with universities there and other trainees. Has that grown, and what are the barriers to growing it even further so that you empower the people on the ground year-round to be providing the service?
Oh, absolutely. So that's a part of the goal. We work side by side with those who are there in country. They teach us as well as we share information with them. So it's a give and it's a take. But the challenges really are around resources. That's been the major obstacle. Resources, lighting, electricity is a challenge. If you can imagine working in a country where the water supply is not always as it should be. And so that leads for significant challenge. Medications are not available. So we had to take with us everything that we needed to utilize to make sure that we provided service similar to what we would do in the United States, and that's expensive. So barriers are mainly around resources, not talent, not people, not goodwill, but just making sure that we have the resources that are needed.
And how long are the electives when the students and faculty go there?
Well, we started with 2-week rotations. We wanted to make sure that we embedded the rotation into a rotation that was similar here at the College of Medicine, so that students who traveled would receive the same educational experience as a student who did not. So we did 2-week rotations, plans to expand, but we're on hold right now.
Right, excellent. So I just want to switch gears a bit to the current pandemic and kind of Howard's approach. And obviously you are our primary quarterback in your role as Chief Medical Officer. You're standing up not just the Department of Medicine, where you're the interim chair, but you also are really safeguarding the entire practice of what occurs in the hospital. What has been probably the greatest challenge during this pandemic, given the demographic of patients that we see?
All right. Well, I think what's been most challenging is just seeing how sick our patients really are, and making sure that we are able to support the clinicians who are taking care of them and the patients' families as we go through these transitions. But I will say what we have done is just more than phenomenal. You would be so proud of how the teams have come together to review the literature, to make sure that medications are in place, to make sure that we are using the ventilators in the most appropriate fashion, and to make sure that we're educating and supporting each other. So when we talk about interdisciplinary and multidisciplinary, each of those areas has come together in a most substantial way. Our pastoral services, social services, our patient experience team, nurses, all the physicians of all the different disciplines. And we've even had students who've called and said, look, we want to help, we want to come back. We're just looking at ways that we can do that safely. But the patients have been very, very ill. And that is a significant challenge for those who are taking care of them.
And with that in mind, the discourse, the national discourse has really turned to that healthcare disparities, which obviously we've known for a long while have existed. In the middle of this crisis, obviously, it is now resulting in significant lives being lost. Are you seeing the same type of things that has been reported nationally at Howard University Hospital in terms of that disproportionate mortality?
Well, the majority of our patients are African American, but I'll tell you, we've been so far successful in keeping our mortality rate lower. And so we continue to follow those numbers and look to giving more detailed information about that in the future. The team has been very nimble and reacting very quickly to information that has come to them about managing the patients.
We had to expand the hospital beds because of concerns about the surge capacity while taking care of very sick patients. So that probably is as disruptive as you can get to have that major construction going on. How have you tried to adjust to make sure that things like PPE were available to everyone involved, to make sure that the caregivers in particular felt comfortable providing the care that was necessary?
Yeah, so very early on we stood up our task force to make sure that we connect everybody, give everybody, all the disciplines, an opportunity to ask their questions. If you recall that we did well in taking care of patients with Ebola, so we were used to the training that we had already gone through PPE. We actually had a containment unit, though small, but in place, and so this was not completely new to us, but new in scale. So it's about the training. We got everybody through their PPE training and reminders, the videos in place, and so our infection prevention team did an excellent job with that. So every area that required enhancement, we made sure that we did. And really, it's about working together. There is no way that one person or one team could take care of this without the other. So we just made sure we communicated well, support our frontline staff, tried to get them everything that they needed to feel safe. We instituted our masking policies very early. And instituted other policies to really support our caregivers.
And currently, the frontline staff are being tested en masse. Tell me the thought process behind that and what you hope to learn on the other side after all the testing is done.
Absolutely. Well, we started the testing because we want our patients to return to us, and we want them to feel safe, that they're in a safe environment. Those who are taking care of them have been tested, are serious about this. There are still some questions that aren't quite answered yet. We will know exactly what percentage of our healthcare workers are positive. We know that it's been below 1% in a number of other areas, but we'll continue to monitor that. So it's about safety and keeping our healthcare workers safe, keeping our patients safe.
Now, as the numbers of patients who are COVID positive begin to decline, we open back up for elective care that hasn't been provided. And there's a lot of data that has suggested that the death rate of the general population at home, if you look year over year, the number of people who've died at home has skyrocketed in certain municipalities, including ours. What do you anticipate would be the challenges as the city begins to reopen? The mayor has just announced her phasing plan. As that begins to occur, what do you think the challenges would be around providing the elective care that was not being provided before?
First of all, I think we need to make sure that our patients know that they need to come in to see us, that we are providing a safe environment. Any study that has been delayed or deferred, now is the time to plan to have that procedure or studies done so that that care can be delivered. As far as challenges, we are still hoping that everyone will continue to wear their masks, do the hand washing and social distancing as we continue to reopen. Right now it's mainly keeping people safe and keeping down the number of transferred infections.
Right. And do you think you'd be able to manage the volume? Because there is a concern as well with the healthcare system that while we were worried about being overrun by the pandemic, we basically have shut down giving care for 90 days or so. And now we're asking all those people to come back in a flood, and they may be coming back with very extreme conditions from their chronic illnesses.
Yes. So we have increased the number of beds that we have available in the hospital. We have an area where we have patients who are COVID positive. We've increased our ICU capacity, and so we will be able to safely care for those patients.
And for everyone who comes on that has anything to do with Howard University, my closing question is the same, and I'm going to pose it to you as well. Why Howard University? For that young woman in Baltimore or Detroit who's going to listen to this and is thinking about that career, thinks that being a concert pianist is great, but maybe being a general internist is her calling.
Absolutely. So Howard is all about possibilities. I think it's a place where you will learn who you are, what you have the opportunity to do, places you can go. I think that anything that you might ever dream of, there's a possibility of experiencing that at Howard University. So you've got to come Howard. Got to come to Howard.
All right, excellent. Thanks for being here. My guest today was Dr. Shelly McDonald-Pinkett, Chief Medical Officer at Howard University Hospital. I'm Dr. Wayne Frederick. Please join me next time on The Journey.
This program was produced by WHUT, Howard University Television, and made possible by contributions from viewers like you. Thank you.